Hey everyone, I'm Dr. Kirsten, veterinarian here at ManyPets, and in today's video we are going to talk about dysplasia. We're going to talk about it in two locations, both the hip and the elbow. Now this is something that I see not infrequently in the clinic. I have owners coming to me about this a lot, but it's also very common for them to not particularly understand what the condition entails, how it can be managed and or treated. So first of all, let's clear up terminology. Dysplasia essentially means abnormal formation. And so when a joint is formed, it is engineered to come together in a very particular way. So if bones grow and come together in an abnormal formation, shape, or at odd angles, what's going to happen to that joint is it's going to have abnormal pressures put onto it. That abnormal pressure is going to, over time, cause inflammation. Like I said, joints are engineered to come together at a very specific fashion. And so when we've got that inflammation going over time, it's going to cause pain, it is going to cause irritation, and we will start to develop things like secondary arthritis. It's that combination of abnormal shape and inflammation that is going to cause signs of discomfort in young dogs. So typically, it's ideal for us to diagnose at an earlier age because that will allow us to have more intervention options. While this is something it is more common to find in younger dogs, some dogs may actually not be diagnosed until they are several years old. In theory, we can see dysplasia in any breed of dog, but I tend to see it more commonly in larger and giant breed dogs, in particular Labrador Retrievers and German Shepherds. If you are a pet parent, some of the signs that you can look for that may indicate your pet has dysplasia in the hips or the elbows will include lameness, which also means limping. It may include lameness that worsens with exercise and improves with rest, reluctance or refusal to exercise, or even something as simple as an abnormal gait. To diagnose dysplasia in your pet, your vet will typically recommend starting with some kind of imaging. For the hips, that's usually going to mean starting with x-rays. That is a really easy and helpful way for us to evaluate the coxofemoral or the hip joint. Now, the elbow joint, we can take x-rays as well, but we have to remember that the elbow joint is a little bit more complicated when it comes to formation. The hip joint only has two bones, the femur and the pelvis coming together, where the elbow actually has three bones coming together, so they may recommend slightly more advanced imaging like a CT scan. Let's talk about diagnosis and treatment of dysplasia. There's going to be a series of questions and a lot of factors we want to consider when we're deciding what our options are. What's causing the dysplasia? How severe are the anatomical changes? How severe are the clinical signs? What can owners manage in terms of surgical aftercare? What can owners financially plan? Like I mentioned, sometimes surgical intervention is going to be a possibility, and that's going to depend on the condition that is diagnosed. So how those bones have come together, and also how much pain the patient is experiencing, as well as how old is the patient. In some cases, surgical intervention is not an option, and we look to medical management to support these patients over time. Some of our most common components for medical management of pets with dysplasia are going to include things like pain relief, weight management, physical therapy and other adjunctive therapies like laser or acupuncture, using some approved joint diets and or joint supplements. Unfortunately, with cases of hip or elbow dysplasia, costs can add up quickly. Surgical intervention can easily reach anywhere in the range of 3,000 to 7,000 pounds. Additionally, I think people also believe that medical management will be less expensive. I can also tell you from experience that these medical therapies can add up cost-wise over time. Some insurers will pay out for dysplasia if your pet was diagnosed after your policy has started. So it's important to think about that as a tool when it comes to planning your finances. I hope this video helps you get a better understanding of dysplasia in our pets. If you have more questions or want more information, check out our article on the ManyPets website.